the mom and the baby that died from the VBAC at home,
Ugh.
basically is what it was. And she's got, what was it? She's got 3 children before this 4th one.
Yeah, this was number 4. All of them were under the age of 5. So that's 4 within 6 years, which means we have close intervals. And we know that she had at least 1 C-section. She may have had more than one. She may have had more than 1 HVAC or attempted. I don't know if you remember from the woman who she was just obscenely high risk. She had nothing but preterm babies. They were all C-sections. And so that was 3 of them. She had 3 daughters. And then she went to, it was a VBAC group. It wasn't ours. It was a Facebook group. And she found a certified nurse midwife to take her on, supposedly. She was just incredibly high risk. She actually carried her pregnancy to term. Her contractions started at, I think, either 39 or 40 weeks. And she was actually in the blow up birthing tub when she ruptured. Anyhow, she almost died from the blood loss. Her son died. It reminded me a lot of Adele Rose, where she was just textbook. She was in pain. The contractions stopped, which is like a really bad sign. And they lost the baby's heartbeat. And it's like, and then Adele Rose transferred her in a car. And it's like, oh my gosh, you were like definitely in ambulance territory. Why did you do that? They lost the baby. The woman lost her uterus. She ended up in the ICU. And the doctors were so appalled that they were the ones who filed the complaint. So like this woman comes in and practically the same scenario. Only difference is she passed out before they transfer her. They did lose the baby's heartbeat. Contractions stopped. She came to the hospital. They thought they had baby's heartbeat, so they did a C-section. Her abdomen was completely full of blood. Baby was passed already. Mother apparently coded on the table. They brought her back. She died, but she had too much brain damage from either cardiac arrest or loss of blood. And then they donated her organs. It was like, oh my gosh.
Yeah, I read that part where they said they did the walk with the mom and the baby.
And the 3 sons following her. And I was like, oh my gosh, if you're not crying when you read that, it was just like, so it was just one of those things where it's like, you know, whatever you want from birth, you want to be in a safe place. So that does not happen.
What do you want for the rest of your life and your kids' lives and your spouse's life and your baby? I mean, you know, it's not as big a deal as you think to have a less than perfect birth experience.
Yeah.
What did your sons want too? You know what I mean? Those little boys behind you, they wanted their mommy.
And I hate to say, because it's, you know, I've been around in the natural community for a while. So we know that moms are dying all over the United States, all over Canada, Australia, the UK. They're dying at home. Nobody's talking about it. We barely ever hear about the babies, but we know moms, it's happening. We can hear about them, very, very little whispers about them randomly will pop up. We'll see something, you'll never see it again. You can't look it up. It's not in the news. It's not anywhere, but it is happening. But this one particularly stuck with me because she wasn't a first-time mom. She's had babies before. She left all of her living children. She lost that baby too. So you have now a grieving father with these kids that has to deal with, now my wife is gone, now another baby is gone. All that stuff, those little ones have to grow up without their mom over a birth choice that is totally preventable. And the reason it really stuck with me is one of our big groups is the VBAC group. And it's a huge, huge thing that we see so many people come in and think they can have a VBAC at home or at a birth center or someplace that is not in the hospital. and they think it's completely safe, and they're hearing all this bogus information, and it's bogus. You know, we have misinformation coming from midwives, from doulas, from natural birth keepers or followers that think it's fine. It's not fine. You had a C-section for a reason. Whatever that reason was, you've already had it. You can't go back. You can't change it. You can't have a vaginal birth at home and expect everything to be okay, because chances are it's not okay. If first-time moms are dying or losing babies at home, imagine now you've had trauma to your uterus, trauma to your body from having, you know, depending on how long, we talked about like how long of the intervals, we have no idea how long it was before she got pregnant again. And maybe another factor that we see is she might have had the baby at home because she wanted a VBAC, but no doctor wanted to give her a VBAC because it was too close. And they were probably telling her, you're going to rupture and it's not safe. I don't feel comfortable doing this. She probably went around to a few doctors, thought, oh, bees are being mean to her, thought they're, you know, attacking her or whatever it is, or going against, you know, I want my vaginal birth. She's probably hearing the nonsense online, gets whatever midwife, any midwife, I don't care what level, even a doctor, if they can tell you can birth at home, they do not care about you. They are not good. They are not medical. It's complete bogus stuff. Your life matters more. Why aren't we doing things to protect each other? Why aren't we saying the safest place is the hospital? So like reading this really, really has been like eating away at me since you posted this like a week or two ago, because I just keep thinking about how often we see people come into the VBAC group that say, I'm thinking about this birth center, or I'm thinking about having my baby at home and I have a nurse midwife. It's fine to have a nurse midwife. Who gives a crap? Throw all of that out the window. You can have an OB at home, but do you think they're going to do a C-section on you when you need it? No. And do you want a C-section at home? Probably not. It's not going to be sterile. It's not going to be clean. You're going to get an infection. Like we have to face the facts. This is not Grey's
Anatomy.
This isn't like we're doing things chat. This isn't on TV. This is real life. And what happened? Our beginning things of C-sections, a lot of times people died. Well, we also were learning about infections. We were learning about the body. We've learned over the years, the best place is that OR. No one comes into your room when you're in the hospital and need a C-section and does it right there. They take you to an OR for a reason. There is a good reason for it. And I think people need to understand that, yes, it's traumatic to go to the OR. Many of us have been there. We understand the OR is scary. It's a scary place. It's not your comfortable birthing room with a birthing tub. And you can recommend it's not fun. It's not fun. But you know what? When you gotta go, you go, and you just kind of just go with it. And that place is safer than where you would be at home or at a birth center. We need to just really make this clear. Even a birth center in the parking lot of a hospital, you still have to be transferred to the hospital, whether they put you on a gurney and they're running down the halls to get you there. We know from Megan coming on, sharing her rupture story, she was down the hall and they almost both died. That was a hospital birth. So what do you think is going to happen when you got to get on the gurney? A lot of those places, you got to go get on an elevator. Elevators aren't fast. You got to get into the room. Everybody's got to be prepped. Like we all know, like if you actually know the layout of hospital, most hospitals are not one level, and you're not just going in and you don't just go right to a room. They got to do stuff. There's a whole team, and they have their own set like protocols of what they do before they can even do that stuff. They want to get an IV in you. They want to get, they got to get you prepped. There's a lot that goes into this that no one is talking about. And that's why I was like, we have to talk about this, because I feel like there's so many pieces because of all the misinformation that people aren't hearing about, of all the details that we need to know of why you need to have your baby in a hospital. I say this for everyone. I know we talk about birth choice, but the hospital is in fact the safest place all over the world. Doesn't matter where you are, doesn't matter who you have. It is the safest place because it has the tools and the means to keep you alive and your baby alive, because things just happen and sometimes you don't have the time. You just don't have it. It's not there.
So when you're picking a place to give birth, the reviews of a birth center mean nothing. So there's someone who is saying, this is a VBAC specializing birth center. And they have great reviews. Awesome. Do they do continuous electrofetal monitoring? Because 80% of the time, that's how they catch a rupture. If that's what they're doing and they're, in a hospital, that's how they're catching signs that this baby needs out. So your midwife with that little handheld thing is not listening at the right time, and they're not listening long enough. So that's the biggest reason why you see the people, especially in the VBAC group. I know we get a lot of hate for saying this stuff, but there's a risk of rupture. And the only way to be able to tell is to have the right tools. And most birth centers do not.
It kind of boils down to like just because you can do something, you can find someone who is willing to do this, doesn't mean you should. And I get wanting to deliver like where you're most comfortable, but like, where's the safest place? That has to be where it is. You know what I mean? Like, I can do this. Should I do this? I can give birth at home where I'm comfortable, or I can give birth where I'm safe. Like, it's just about learning to like switch the words, I guess, too, a little bit to focus on like, I can, but what should I do?
Well, let's address the most common phrase I hear, which is give birth where you feel safest. And it gets on my nerves every time I hear it, because in architecture or landscape design, one of the things people will be like, I need a fence. Why? Why do you need this fence? I don't want to see my neighbors, or I don't want my neighbors to see you. And the funny thing is, we can architecturally, I can get rid of the need for the fence because you think you need the fence simply by interrupting your eye. The way when you look over, as long as there's something that interrupts your eye, you will feel like your neighbor can't see you and you can't see that. And it's funny because it's kind of like, that's what people want. They want the feeling. They don't actually want, to have Fort Knox. They just want the feeling that they are safer, secure, and invisible to their neighbors, which is I'm good with that. But when people say birth where you feel safest, that is not the same thing as birth where you are safest. And it's like, the question is, how safe is X? How safe is Y? And people will be like, well, something bad happened to me. And it's kind of like, okay, that's unacceptable. We don't want something bad to happen to you, something where you feel very uncomfortable or violated. But the best way to address that is go to your provider and say, this happened. Go to your patient advocate, say, this happened. I didn't like it. How can we prevent it from happening again? Because you think, I'm going to go and I will have a birth in a birth center and I will have a birth at home, and this thing will not happen. Well, guess what? There is zero reason to think it won't happen there, because I have heard of just really bad stuff happening at home births and birth centers. And it's not, did you say, this is the reason I'm choosing you? I'm choosing you because I had this happen to me and I don't want this to happen to me again? Or do you simply say, oh, you're just such a great midwife. I really trust you. You seem really loving. You seem to really care about me. This is why I'm choosing you. Because you haven't addressed the real problem you're dealing with, which is like, I didn't want this to happen and it happened. And it's like, there's a lot of stuff that happens at home births you don't want to happen. Trust me. And a lot of it has to do with the midwife failing to inform you of what is happening to you, failing to inform you of the risks you're taking. It's like home birth is a lot of feelings and not a lot of facts. And it's definitely not as safe as you may think.